Hello and welcome to our webinar this morning. Thank you very much for joining us. My name is Rosie and I'm the Chief Executive Officer at Student Minds, the UK student mental health charity. I'm very excited to be joined by my co-host today, Anisca Sohel, who is both a student and also a trustee for Student Minds, a long-time Student Minds contributor, volunteer, and also the presenter of the All Things Mental Health podcast. So hello, Anisca, lovely to see you.
Hi, Rosie.
Hello. We thought we'd just set the tone a little bit, really, for everybody joining us today before we get started. So the purpose of this event is really to give you an overview of where we're at with Student Space, introduce you to some fantastic new services that are going to be launching. So very excited for you to join us. I think also because we're going to be speaking about particularly communities most impacted by the pandemic, very mindful that this can bring up lots of different things for us as we participate today. So I just wanted to highlight for everyone to say, do take care of yourselves during this webinar. You know, we are encouraging you to take breaks if you need them. If you're a student and you're looking for support during this webinar, please do go onto studentspace.org.uk where you can find out about the services that are available to you. And particularly if you want support now, you can access the tech support. And if you're a staff member and you are also feeling impacted by some of the themes in this, you might want to reach out to something like the Samaritans on 116123. So you will have also noticed that the transcription on Zoom is doing its best to try and translate my Coventry accent. So hopefully this will be of use to you as well, should you like to use it. And I think other than that, I want to take us on to giving you an introduction, a bit of background onto the programme. So if I go on to give you a summary of Student Space. So for those of you that are new to the programme, Student Space launched in August in 2020 to support students to find the support they need during the pandemic. And there is three ways in which we're supporting students. So the first is through dedicated support services. Very grateful to have worked very collaboratively with Shout, run by Mental Health Innovations, and The Mix, in order to give students the option to access support by text, phone, web chat, or email. We've also developed a whole suite of information, tools, and student stories, really responsive to the ups and downs of the pandemic as they've unfolded. And finally, we've worked with the sector to populate a directory of university support. So you know where you can go in your own institution, be it through your student services or through your students' union. And we're really proud and really grateful for everybody who's played a part in that. Over 130,000 people have accessed the site since its launch just a few short months ago. Through this fund, it's enabled our partners here to support thousands of students through their direct services. And we're really starting to get great feedback from students on how useful they're finding that content as they navigate this experience. So who has supported this? There's a lot of people that's been involved. We want to say a huge thank you to our funders, the Office for Students and the Higher Education Funding Council for Wales. And those of you from Welsh institutions will be pleased to know that some of the materials that we launch off the back of this to promote this new services will be made available in both English and Welsh. There's been a whole range of organisations involved in this. So through our advisory group and also through our governance group who help us think strategically about the programme, a whole range of organisations in the higher education sector, in the health sector, a range of digital experts. We really couldn't have done it without the input of these fantastic organisations. I'm really excited about how collaboratively we can really tackle challenges like these head on. And finally, I wanted to say a thank you to all of you. We know that individual partners, staff members, students themselves have played a massive role in promoting these services over the past few months. And there's a few, just to give some examples on the slides there. So thank you for spreading the word. So I think it's time for us to start getting into the main bulk of this event. And really to frame this, our starting point for this event is recognising that we know this has been a difficult period for all students. All students have had their experience impacted in some ways, but also that not all students have been impacted by the pandemic equally. And we think really it's important that we start there. So I'm shortly going to be handing over to Niska, but before I do that, I want to just give a summary of what we're launching for you today. So we are launching a new package of innovative tailored services. Through all of our listening, we've been able to see particular communities are being most impacted. There are many groups that we would love to connect with, but we think that this is going to help us really reach out into some communities at this stage. So we have a number of services that you'll meet today, providing support for racialised and minoritised students, so particularly picking up experience of Black students, Punjabi students and Muslim students. We're going to be looking at the support for trans students, the students that might be questioning their gender, thinking about students from working class backgrounds, and then a number of mental health areas and conditions and experiences, from OCD and BDD to students who hear voices or have other sensory experiences, and through to eating disorders. So a lot of fantastic range of services and themes for us to pick up today. And on our next slide, you'll see the names of those organisations. So look forward to hearing from them very shortly. So Aniska, how's today going to work?
Wow, Rosie, we're really excited for today. The event today will consist of 4 different discussions, and Rosie will chair the first 2. The first one is the panel, which is all about supporting students with specific mental health conditions and experiences. And this will be followed by a fireside chat, which is all about supporting students from working class backgrounds. And I will host the final 2, starting with the fireside chat about supporting trans and gender questioning students, followed by the panel on supporting racialised and minoritised students. Please use the question and answer function at the bottom of your Zoom app to ask questions throughout the event. Some will be asked to the panelists directly, and others will be responded to through the question and answer function. We'd like to encourage you guys to also tweet along as well throughout the event using #StudentSpace. In order to ensure that as many students as possible can benefit from the services we are launching today, a comms toolkit will be shared with all attendees following the event, so you can let your network know about this new support offer. And Rosie, I'd love to hand back over to you to tell us a little bit more about the ins and outs of some of the Zoom details today.
Brilliant. Yes, so we just wanted to also highlight that to improve your experience during today's session, it might be helpful to hide the non-video participants. And there's going to be a lot of us coming on and off the screen, so it just might make it a little bit easier to engage with. So you can use the settings in the top right of your screen and just remove those that are not using their video. Fab. So I think we will move into the first session. So thanks, Aniska. I'll see you later on. And I'd love to welcome Lee, Fiona, Rob and Jess to the virtual panel. So I'll give you a moment to join us. And you can see the organisation we're starting with. So Jess is a student at Exeter University. Lee is the Chief Exec at OCD Action. Fiona, Senior Development Worker at Voice Collective. And Rob, who is a counsellor and psychotherapist at First Steps ED. So welcome everyone. I'm going to come to each of you in turn and get you to give a very short introduction. So to begin with, can I go to Lee?
Thanks, Rosie. So at OCD Action, we know that OCD averagely exists with people for about 12 years before they get the treatment that they need. And we have a vision of a time when everybody gets the treatment and support that they need at a time that they need it. And alongside our community within the OCD community, we are really fighting for that vision. But until that time exists, at the moment, we provide support, information and guidance within a supportive community in the hope that that helps people have the tools and and support that they need to move along their journey in the way that they want to. So in a nutshell, that's who OCD Action are. We support people with OCD and related conditions, and it's a pleasure to be with everybody today.
Thanks, Lee. Fiona, hello.
Hey, hi everyone, my name's Fiona. I work at Voice Collective, which is a project based at Mind in Camden. We work basically all across the UK with people up to the age of 25 who maybe hear voices or have other sensory experiences that are sometimes related to diagnosis such as psychosis, but also come under umbrellas of relating to trauma or spiritual experiences. And at Voice Collective, we're very much about kind of giving space for people to explore what their experiences mean to them. And we do that through different means, through peer support, through one-to-one support, through family support, through delivering trainings. So we try to tackle these issues on lots of different bases. And we're really excited to be now creating some student-focused services within Voice Collective as well. Because yeah, I know from personal experience that those kinds of more intense experiences were really difficult at university. So I'm really happy to be here today. So yeah, thanks. Thanks, Rosie.
Thanks, Fiona. And Rob.
Hello, yes, thank you. I'm Rob. I'm coming today from First Steps ED. We are a charity that supports individuals struggling with eating disorders and associated mental health difficulties. We offer quite a broad range of support, from things like counselling and psychotherapy to online befriending, including like group support as well. And we work kind of very variedly across the country, also providing kind of like awareness raising and training opportunities as well. But yeah, that's us in a nutshell, really. Thank you for having me today.
Excellent. Great. And so we thought it'd be brilliant to start where we always like to at Student Minds is hearing from a student and hear some reflections, really. So I'm going to come to you next, Jess. So thanks for sharing with us today, and really just to get a sense of what your experience has been during the pandemic.
Thank you so much, Rosie. So my experience in the pandemic with OCD has definitely been challenging and quite isolating. I view my OCD as an overprotective but quite unhelpful voice in my head. So before the pandemic, through treatment, I learned that the threats that my mind, my OCD was trying to protect me from, they weren't actually real. So I knew that not giving in to certain behaviors or compulsions, I knew that it's not going to change the outcome. So for example, if I wash my hands 6 times, a bad number, as opposed to 4 times, it's not necessarily going to cause something awful to happen to my family. However, during the pandemic, these threats did essentially become real. If I didn't wash my hands thoroughly or enough times, then there was an actual chance that I could contribute to essentially the death of a family member by spreading the virus, which, as you can understand, is probably quite distressing. So since these threats became more real, I did give in to my compulsions a lot more often than I was before the pandemic. And this only made the OCD stronger, and it made it a lot more debilitating for me. I felt like my last 5 years of progress and of this journey to recovery had gone down the drain. And undoubtedly, this had a major negative impact on my relationships with those around me, my university work and grades, and really damaged my self-esteem.
Thank you so much, Jess, for sharing that with us. And I think you really highlight what has been challenging when you were already working so hard on that recovery and that support, and then this is something so unexpected to deal with. I think it'd be helpful to start actually with Lee and kind of responding to some of those themes. We know that, you know, through student testimony, through surveys and some of the data that is available to us, that students with some specific mental health conditions and experiences have had additional challenges. So could you tell us a bit about how you're going to react to that with us, with Student Space, and what OCD Action is going to be providing in the next few months?
Yeah, absolutely. And thank you, Jess. I think you articulate really well some of the disproportionate impact that the pandemic has had on people with OCD, and also particularly on students. we know that people with OCD have been hugely impacted during the pandemic, often people that have come a very long way in their journey with OCD. And for some people, have experienced symptoms of OCD for the first time during the pandemic. And it's something that at OCD Action we feel really passionately is something we need to provide more support and do more work around, because at the moment there are challenges with accessing services for very understandable reasons. Everybody's been put under a lot of pressure. So our kind of ethos, the work that we're really focused on is we really believe in connection and community at OCD Action. We believe that can make a big difference. I think it was one of the things that you picked up on, Jess, is the impact that it can have, having OCD, and the isolation that OCD can have on you. So our project that we're particularly and we're really pleased to be able to bring to this collective of work is a support project, basically a peer support project. So we want to provide safe spaces for students to come together and share their experience, their ideas, their tips in a group that is facilitated by a current student or a very recently graduated student, so that it can really create somewhere where people with OCD, BDD and other related conditions can really share that, have that space for shared understanding. And we think that can be incredibly helpful in moving people along on their journey. To go alongside that, what we'll also be doing is having group-based information sessions, because I think often it can be really challenging when you're kind of experiencing the sort of symptoms and experiences that Jess was talking about, to know exactly where to go to get the right information and support. And so we'll be providing group-based information sessions facilitated by somebody with lived experience, but also an expert information giver. And then alongside that as well, we'll be holding expert-led webinars monthly to make sure, and we hope that collectively that kind of those three layers of things will provide students with the support, information and tools that they really need to help them move along on their journey at this really difficult time.
Thank you, Lee. And I think picking up on that point of community, it'd be great to now hear from you, Fiona. So I think we recognise that the experience of hearing voices or having unusual experiences has probably had less of a key sort of profile in our sector. So it'd be great to hear about what Voice Collective is going to provide. And I know that you do a lot, you're very thoughtful about the words that you use, so explaining a bit more around that as well.
Not easy to do in a short period of time, but I'll try to catch it in a nutshell. So yeah, at Voice Collective, it's not just the language we use, but I guess it's an underlying ethos around respecting people's autonomy and making sense of their experiences in their own way, and having their own conceptualization of their distress and their mental health, and working with them to kind of find, their own frameworks and their own ways of navigating those challenges and kind of being alongside them in that process. And part of that is trying to use language that doesn't necessarily hold much judgment on their experience and more serves to describe it, and tries not to pathologize it in any way. And then if young people feel like more medicalized language fits with their experience, then we are happy to go with that. But we're also trying to make room for other narratives for people to use when thinking about their experiences and making sense of what's going on for them. And so at Voice Collective, I mean, voice hearing is a really stigmatized experience to have, and most of the narratives around it are kind of sensationalized, or kind of in the media, they're kind of made out to be really negative experiences, but there's a lot of scope for these experiences to actually have messages and have meaning that can be worked with. So as part of what we do with Student Space, we are going to be creating an online peer support group for student voice hearers to join and meet other students who are maybe going through similar things. We have an online forum at Voice Collective where we've made a dedicated space specifically for students to message each other. We'll be delivering training to UK universities about kind of understanding voice hearing from different perspectives. And we'll also be creating some resources around kind of how student voice hearers might kind of cope with hearing voices when they're sitting exams or trying to study, for example, because those can be massive challenges when you've kind of got lots of sensory experiences going on. So yeah, hopefully there's scope for a lot of interesting and helpful work to be done here.
Brilliant. And what's really helpful, I think, across all of our partners is a lot of those similarities in that ethos really coming through. Thank you, Fiona. Rob, come to you next. So the support really that First Steps is going to be providing for students experiencing eating difficulties. And I know that the route to accessing your services will be a little bit different because it'll be through professional referral. So could you speak to that, please?
Yes, of course. So essentially our plan going forward with this is to align ourselves with the NHS services, particularly around their FREED projects, which is a early intervention for 18 to 25-year-olds with a first onset of eating disorders, which we align quite nicely to, as we've been an NHS commissioned service for the last 5 years. So essentially going forward, the idea is for us to be providing our counselling services, our online befriending services, as kind of an extra capacity for these other services that are under incredible amounts of pressure, more so with the pandemic. And the idea being going forward is that we will be that kind of secondary capacity, that kind of robust support for professionals to be able to refer, you know, students, young people towards us, as opposed to creating that whole new referral pathway, if that makes sense.
Absolutely. And I think actually I'm going to pick up one question at this point from the audience, which someone's asked about the financial pressures really, I suppose, on higher education, but also on wider services through, I guess, the NHS and third sector as well, and the impact of that. I think that kind of builds on something you've just said, Rob. So I guess how the panel thinks that landscape will impact students' access of support. I wonder if anyone else wants to contribute to that one as well. Lee?
I mean, it's certainly something that at OCD Action we're very concerned about for across the board, including for students. You know, I think the financial pressures that are on all services as a whole are huge, and with the pressure now of the pandemic and the impact that is having on all services, I think it's something we're really concerned about the timescales that are available for people to be able to access the treatment that people need, that waiting lists are increasing, and the impact that is having in terms of people's quality of life and the experience of their mental health conditions.
Thanks, Lee. Does anyone want to add to that at all before I come over to Jess? Okay, I think I'll just add to that. I think there were some questions about how students' unions can engage as well, and it sounds like there might be something around how we capture and explain those needs in local communities and in particular cities and university towns as well. I suppose there's something really important here as well, just we're trying to get that message out to students that, you know, whilst there are a lot of challenges facing society at the moment, that there is a lot of fantastic support available, and that's some of the things that we're highlighting today. So Jess, just to ask you really, having heard from the fellow panelists, why do you think that providing tailored services like those are important?
Well, first of all, I think like all these services sound brilliant. And obviously I can only speak from an OCD sufferer's point of view, but for me, having OCD is super isolating in itself, as you do sort of view yourself as a freak. And in the pandemic, obviously I found it to be even more isolating, as I'm sure many did, with or without any mental difficulties. Therefore, something like a support group or a support network for people who are going through the same thing at the same time, especially as students, I think it would be so helpful and reassuring. And in general, just more awareness and better education on these matters is just such an important and great starting point. So I'm just thrilled to see this being put into action, really.
Thank you so much, everybody. I'm going to now invite colleagues here to switch back off their cameras, enjoy the rest of the event, and we'll now be going on to our first fireside chat. So it's like a different format for this one, and would like to welcome Becca and Precious to turn on their videos and mics at this point as well. So for this panel, we're joined by Precious, so a first-year student at the University of Birmingham, hello, and also Becca, the Youth Engagement Officer at Reclaim, charity aiming to create a society where being from a working class background no longer presents barriers to achievement, success or influence. What a fantastic summary there. So I'm going to start with you, Precious. So it'd be fantastic again to hear your perspective of some of those specific or unique challenges that students that are from working class backgrounds might have experienced in the pandemic.
I think one quite major issue that I feel like is quite obvious is financial issues. Normally it's expected that when you're at uni you work, not expected, but for a lot of working class young people, will pick up a side job, especially if their student finance doesn't cover their cost of living, which for a lot of my friends it really doesn't cover their rent. But due to the pandemic and COVID, there's no jobs. I don't know a single person who works. Everyone lives off their finances, which is the bare minimum. And we don't have the parents who have the facilities to support us. Unlike if we were from like a richer background, whose parents, you know, you can always rely on your parents to have your back. But for a lot of my friends and like me personally, my parents don't have the facilities and the means to support me as like a whole human being living outside. So finance is quite slim. And I know obviously it's the stereotype, you know, you're a uni student, you're slumming it, you know, you don't have the most money. That's already a typical stereotype. But that upon a lack of work, a lack of income for most people has taken a toll. So it's like, not only are you stuck in a pandemic, and you're trying to do lectures and all that type of stuff, you can't even have some retail therapy to, you know, help ease the pain a little bit. Or like you're thinking, oh wow, I'm running low on groceries, but I've still got to get this, this, and this. I need to get this book for this seminar or something. So it's an added stress, which I feel like is quite expected, and there's not so much that, but hopefully there is stuff we can do for it, obviously, to help deal with it. But it's something that's quite hard to deal with and tackle with, if that makes sense.
Absolutely, and thank you so much, Precious. I think you really highlight there the different levels of pressures that people have been experiencing, because presumably that's in the background of while still trying to adjust to online learning and everything else that we've talked about related to student experience over the pandemic as well. So I think that really helps to set up for us what is that day-to-day experience like for a lot of people. So I'd love to come over, Becca, to you now and hear a bit more about how that really relates to wellbeing and mental health, and what Reclaim's going to be doing with us through the Student Space programme.
Yeah, I mean, I think what Precious said was spot on. Not only are you a student trying to figure out student life, but on top of that, you have got the added financial pressure, and then it's a pandemic. So I think for a lot of working class students, thinking about where their finances are coming from, thinking about not wanting to put a lot of pressure on their families, thinking about whether they need technology, whether they need laptops, whether they need phones for their lectures, has just put a lot of pressure on their mental health, just to keep up with their peers, really. So I think for us, we want to make sure, as we normally do, that all working class voices are heard. So we are going to be launching a webinar, and we are also going to be launching a podcast where working class students or people that have been working class students can come on and really just talk about their experiences as students and how it affected their mental health, because it is so much pressure having to keep up with this standard in university, but also having to get a job on the side and maybe not even being able to do so because of the pandemic. So we really want to create a space where people have just a space to be heard, but also a space where people can come and really get some advice from people that have gone through it and people that are navigating it as we speak.
And that all sounds incredibly valuable. And like you say, creating that, it's almost that informal peer-to-peer sharing that will come through some of that as well. I guess over to you again, Precious. I'm interested to know, you know, beyond the sort of ideas that we've just set out here, what more, I guess, you'd like to see for us to do to build on that work that Reclaim does. You know, there's a lot of people across the sector listening to us today, and to know what more you think that we could be doing here.
Obviously, in an ideal utopia, give everyone a bunch of money, but obviously that's not a realistic approach. One thing that would be really helpful for young people especially is workshops, help them improve their CV, help them gain skills, because a lot of employers, they say, oh, we don't mind if you never done this job before, but they want you to have done the job before. They need you to have those skills, and young people can't get those skills because they can't get jobs. So it's like a never-ending cycle. So stuff to help build skills, so young people have those skills and have the confidence to apply for certain jobs. Because a lot of the time, when young people look for jobs, they're like, oh, I can't do that. I can't do this. I don't have the skills. They'll never hire me. So a lot of the time, people don't even apply to the jobs because they automatically assume. So I feel like helping young people with job listings, job opportunities, job hunting, building their CV, knowing how to tackle and who to talk to, that's something that's really useful. And I think that would be really useful in the future.
Brilliant. Thank you, Precious. And again, I think that gives us some ideas for where we direct some of our asks and energies as a sector as well. Fantastic. So I think just to encourage audience, keep some questions coming in. We'll pick some more up towards the end of the session. But thank you, Precious and Becca. We're now going to go on to our next session. So I'm going to invite Aniska back as well. Who's chairing the next session, and I will shortly hand over to you. We're thinking about the experience of trans students questioning their gender. Over to you, Aniska.
Thank you so much, Rosie. That was an excellent session. Great to see the range of support being offered as well, and different types, from peer support, expert-led webinars, professional referrals, and a lot more too. I'm excited for this next session now, which is, as Rosie said, a panel supporting trans and gender questioning students. If I could ask Christina and Keith to turn on their videos and microphones to join me for this panel, that would be great.
Hi, Anushka.
Hi, Christina.
Hi, can you see me okay?
I can see you. I can see you.
Yeah, okay. So thank you so much for the introduction. So I'm Christina, and I'm the Helpline Service Manager for Mermaids. And Mermaids, as you said, support gender diverse, non-binary and trans young people. Over the past 25 years, we've notoriously supported people up to 25. And during COVID, what we've noticed is there's been a rise in support for young people who feel they're not supported at home, they're in an unsupported environment. And during COVID, that has risen, and we found it's risen as well amongst the older age group, so the over 20s. And so for us, it's about trying to offer more support in that area. We are going to be offering to the 20 pluses call centre. So we have calls, we have a web chat, we have emails, but we also have created a space on our forums, on our bespoke forums, for student space, so that they can get peer support as well. So that is our aim during this period, to see how that takes off and how that works for Mermaids in extending our services.
Thank you so much, Christina. As Christina said, in case any of you didn't catch that, she's the Helpline Service Manager at Mermaids, a charity that supports transgender, non-binary and gender diverse children and young people, as well as their families and professionals involved in their care. And Keith is here with us as well, who is an ex-student who graduated in 2019. So Keith, just moving on to you, in recent years, Student Minds has connected with Daniel Eisenberg, the principal investigator for the Healthy Mind study in the US. Their 2019 data showed that gender non-conforming students were 4 times more likely than their peers to report mental health issues. Why do you think that is?
So I'd say that there's a lot of different reasons. So first of all, trans and gender non-conforming students, they can have negative feelings about their body in the first place. So that can lead to low mood or even anxiety. You know, if you're worried that your voice might be too low, you might be anxious to go out and see people because you don't want people to perceive you as male, for example. But then on top of that, trans and gender non-conforming people, we really get it from all angles. So, you know, our loved ones, our friends, our family, people on the street can be transphobic, or they can harass us, or just, you know, use the wrong pronouns and that. You know, in the media and on social media, trans and gender non-conforming people are being attacked all the time. Gender identity waiting times for NHS clinics are ridiculously long, years long, and that stresses people out. And then, you know, a lot of people feel like the government doesn't support them. There were plans to reform the Gender Recognition Act, but nothing actually happened with that. So it's a combination of everything, really.
And what impact do you think the pandemic has had then on gender non-conforming students?
So, as I think Christina said earlier, trans and gender non-conforming students, they're back home with family who may not use the right pronouns, who may not let them dress how they want, who may misgender them or just say transphobic things to them. So that will impact someone's mental health. But then on top of that, again, because of COVID restrictions, they haven't got the release of being able to go and see trans friends who may support them and validate their feelings, or trans support groups. So it's sort of like a perfect storm, if you will, for negative mental health.
And let's hear what Mermaids are trying to do to help with that. Thank you so much, Keith. Christina, can you tell us what services then Mermaids is going to be offering students over the coming months? And Mermaids has historically only focused on supporting young people up to the age of 20. Why is it now the right time then to extend that support, like you were saying a little bit earlier, to the age of 25?
As I said, we found that we've got a rise of people over the age of 20 contacting us, and that's always been the case. And we've always had a conversation around, should we extend our service? Should we extend our service? And with Student Minds coming along and saying, let's do a partnership with all these organisations and see how this goes, this gives us the perfect opportunity to extend that to 25. And I think that young people up to 25 at university, as Keith has said, there's been a rise in mental health. There's a rise in waiting lists on adult gender services to 3 years now. So these people are waiting 3 years to even get to a gender service. So in that time, they need social and emotional support. And that's where we come in. We offer the social and emotional support by being able to talk to them on the phone, talk to them on web chat, direct them to other services where that's needed, and also by allowing them to connect with each other on our peer-led forums. And so they'll be able to take part in that as well.
That's brilliant, Christina. Also, Mermaids is really has developed really well over the years. So it's now great to see that they're using the experience that you guys have to extend that further, supporting even more people in this time of need, which is great to hear. So I have a question for both of you. Keith, we'll start with you. How do you support, sorry, I mean, rephrase that. How do you think we should set out supporting trans students who belong to intersecting marginalized groups? So for example, if we look at trans people of color, for instance.
So I think services need to be aware of how these intersections can work. So for example, myself, I'm a trans person, but I'm also neurodiverse. Services need to be aware of how neurodiversity can have a negative impact on people, but also as does being trans, and then how combined they can sort of make it worse, but also how things can be inaccessible. So again, with neurodiversity, services might be inaccessible because they're not built around people who are neurodiverse. So I guess, you know, being aware of differences and how these differences can negatively impact people.
Thank you so much, Keith. As we're tight on time, we're going to wrap up this panel. Keith, Christina, thank you so much for joining me for this great conversation. And I'm excited to be moving on now from our chat with Keith and Christina to a panel discussion, which is about supporting racialised and minoritised students. So for this panel, I would like to ask Shudanjeet, Yannick and Madia to turn on their videos and microphones, so please join me. Thank you, guys. So just a little reminder as we move on to the next section and final section as well of today, just to tweet along as well as you go. So you can tweet over any questions you might have, any comments, using the hashtag #StudentSpace. Thank you so much for that. So today we're excited to have this panel with Yannick, who is the co-founder of Black People Talk, Shuranjit, who is the founder of Taraqi, and Maria, who is the CEO of Muslim Youth Helpline. So Yannick, Shuranjit, and Mariah, thanks again for joining us. If you could all each please briefly explain your organizations to us, that would be great. And Yannick, it would be great to start with you.
Okay, thank you for having me. Essentially, Black People Talk is a non-profit organization that deals with Black mental health. That's it in a nutshell. And so in just one of the programs that we have is the Black Students Talk program, which essentially deals with Black students' mental health within university. Now, when I say university, I say at this current stage, we are very much looking at the university higher education stage of it, but we have hopes of moving to a more of a college setting and potentially further down the student life cycle. Yeah, we essentially established peer well-being support groups for students, for Black students, essentially with the aim to create spaces for them to be themselves, for them to talk about their mental health, for them to learn about their mental health. It's a place of acceptance, a place of understanding, and just a place of community, because it can lack sometimes in sort of like, you could call it deserts like university, when it comes to just like one can feel very much alone, and it can help sometimes to feel like you're part of a community, to feel like you're not essentially going through this alone, and your experiences are also felt by other people. So that is essentially it.
Thank you so much, Yannick. And someone who's a student themselves can completely resonate with that too. So great point to have made. Shuranjit, can we move on to you, please?
Sure thing. So hey everyone, my name is Shuranjit Singh and I'm the founder and director of Taraqi, an organisation that works with Punjabi communities to reshape approaches to mental health. So I started Taraqi just over 3 years ago, ironically, because of my experiences of mental health challenges when I was transitioning from home, which for me was Birmingham in the UK, into my undergrad. So it's those experiences of mental health challenges as a student that really prompted me to start this work. So at the moment, Taraqi focus on 4 key areas. We look at mental health awareness, mental health education, social supports, and then also research. And I'm really excited to be working with Student Space to focus on our social supports kind of offering, and thinking about how we can best meet the needs of Punjabi students within that as well.
Thanks so much, Ranjit. And Maria, can we turn to you?
Hi everyone, I'm Maria. I'm representing Muslim Youth Helpline. We are a faith and culturally sensitive support service helpline for vulnerable Muslims in the UK. And we have been operating for 20 years, and we provide emotional support and signposting to our service users through 4 platforms. So that's phone, email, web chat, and WhatsApp. And interestingly, MYH was started 20 years ago by 3 18-year-olds who clearly felt the gap in support services for young Muslims at the time, and we've grown from there.
Great to hear. Thank you so much. So my first question will be to Yannick. So Yannick, the past year has been particularly tough on Black students, with the disproportionate impact of the pandemic and also the devastating death of George Floyd and countless others that brought the Black Lives Matter movement front and centre. What impact do you think all of this has had on the well-being and experience of Black students?
Now, we were experiencing the impact just like every just like every single Black student in the UK, just like every single Black person in the UK. We were essentially running our summer sessions when George Floyd was murdered. So it was during that entire time. So we felt firsthand, people brought that in, even though we had topics in a session, people really brought that in. There was a sense of sort of like a collective trauma and essentially we all collective trauma and collective grieving process. Now, the interesting thing that I want to say is that things really haven't changed. Things have stayed the same. I mean, even though a few days ago, the person that actually murdered him was actually prosecuted for that. Just leading up to that, a young black girl was shot and killed by the police. And it's the funny thing with this racism, and reason why I say collective grieving and collective trauma is because these are all just, we experience racism as a weapon used against us. And we experience that, whether it's a gun, whether it's stopping us from achieving things in life, whether it's discriminating against us. These are all just weapons. And this is an attack. So it may be, whether it's in the US or whether it's over here, these things are all just mirrored, just throughout varying degrees. And it's had a major impact. And what I want to stress about this the most is that the impact hasn't passed. We are still impacted. We are being impacted right now, and it's ongoing. And I guess, yeah, that's the point I wanted to stress the most.
And that's why it's so important to hear the important work that's being done by you guys over at Black People Talk to really help with this. So Black People Talk is going to be holding facilitated workshops over the next few months. Why is it important then to have these protected spaces for Black students? Oh, you're on mute.
Apologies.
No,
it's important to have these spaces because our experiences the narrative of our experiences is often denied, and we are made to feel like, nah, we don't know what we're talking about. Racism? No, there's no such thing. Look at what you're able to achieve. There was a black president, or things like that. So we hear these things. So often these spaces are denied. So if we talk about it, or if we try to advocate for ourselves, so then we get labeled with the either angry black man, or look at that boulder on your shoulder. It's no longer a chip now, it's a boulder. Look at that boulder on your shoulder. Look at this and look at that. So we need spaces where we can come and we can be validated and not made to feel like what we're saying is not true, or that we are going through, so that whatever we experience is not what reality is. So these spaces are really important for us to feel validated, essentially. And yeah.
Brilliant. Thank you so much, Yannick. And it's great to hear the really important work that's being done as well to really help with this massive problem. So moving on to Shoranjit, can you explain how Taraqi is going to be supporting students in partnership with Student Space?
Sure thing. So I remember just about a year ago seeing a comment about the pandemic that called it the Great Leveler. And I was so shocked because, this was something that certainly wasn't impacting communities all around the world equally. And, the research that we did into COVID-19 and Punjabi communities with regards to their mental health showed us that even within Punjabi communities, there were inequalities when it came to how people were being impacted. And one of these things was seeing some of the disproportionate impact on young people, and particularly people within kind of education. And so it's going to be really exciting working with Student Space to deliver facilitated workshops and facilitated discussions to really have those spaces for discussion around mental health and well-being and surrounded topics within Punjabi students, things that they might not be able to speak about with their friends, or things that they might not be able to speak about with their families. Spaces that are culturally attuned, facilitated by people who identify as Punjabi and have the kind of skills to be able to hold these spaces. And also spaces where people can fundamentally build their skills and also build community to kind of pull people together in a way where oftentimes we don't see people kind of brought together. And so what we're really looking forward to is doing this work alongside Student Space and using the knowledge that we've gathered through other spaces that we've coordinated through our work as well.
Brilliant. Thank you so much, Ranjit, for that. So moving on to Maria, I know that you've seen a huge increase in calls since the start of the pandemic. What issues are young Muslims contacting you about?
Thanks, Aniska. MYH has seen a 313% increase in our helpline since March 2020. And some of those issues that we've been contacted for include family issues. So living in close proximity can lead to increased arguments. Family members getting sick can lead to the anxiety and worry. Also, the loss of routine in school and university life and adjusting to online learning, the loss of employment, abusive relationships under lockdown were a huge increase. No access to mental health support, and then also no access to your usual coping mechanisms or the usual support services that our service users would potentially use. Isolation and loneliness was huge. We saw a huge rise in our helpline for calls around that. The Muslim community impacted by COVID fatalities was a big concern, and that led to a lot of feelings of bereavement coming into the helpline. And then also the unknowns around COVID, so the lack of clarity given on school exams, for instance, the changes of roles in the house, so a lot of carer responsibilities or looking after younger siblings and their education, and generally a toll overall on well-being and mental health.
That's great to hear. Thank you so much for that. And I know, Sharanjit, just going back to you for a second, I know that some of the workshops you are offering are going to be intersectional, looking at, for example, LGBTQ+ Punjabi students. Why do you think this intersectional approach is really important then?
You know, so very early on in our work, we recognize that even though we might be thinking we're dealing with a community in the singular, this was incredibly deep, and there were people who existed within different experiences within Punjabi communities. And one of the first that we picked up on was the lack of supports available for Punjabi LGBTQ+ communities. And so we've been working on that for the last couple of years and actually have a space dedicated to that type of work. And so when we're working with Student Space, it was only natural that we wanted to create these spaces for Punjab, which were open to Punjabi students more generally, but also have spaces that were specific to Punjabi LGBTQ+ students, because we've noticed that there were some Punjabi LGBTQ+ students who, you know, were having to move back home and weren't able to be comfortable out in terms of their sexual orientation at home as well. And so there are certain particular topics and ways of talking that really necessitate us having a separate space, and a space that is safe and responsive, not only to the Punjabi side, but also to the LGBTQ+ and any other intersecting identity side.
It's great to hear about this accommodating space, because I know that's something that feeds through the work of all three of these organisations here, which is a great thing to tie them all together. And Mario, just finishing with you then, one of the aims of this new student space support package is taking this intersectional approach, which, you know, like we can see is also evident across the board with Taraqi as well. And you're allowing sort of providers to learn from one another and share learnings with the sector more broadly. What are you hoping to get from this collaborative approach then?
I mean, this has been echoed throughout the session today, but if the pandemic has taught us anything, it's that we're not impacted by calamities quite the same way. So the organisations brought here today and the people that they represent are some of those types of groups which have faced most difficulties in the past year or more. And we have all had to change the way we work under lockdown measures and how our services aren't interrupted, so that we continue to provide our service users with those services. And we put our services at the forefront of those changes. So there is a lot to learn from every organisation present today, and I'm excited to apply this to the support that we can provide to young Muslims. And I know MYH has already been inspired by everyone here and how they've continued to provide those services to each of their service users. So we remain optimistic about that.
Brilliant, thank you so much. And just taking one quick question from the audience as well. I'd like to go to Yannick for this one. So with regards to professional referrals as opposed to self-referrals, how we address the evidence that the experiences of people of colour, especially Black students, are not always taken seriously by professionals. How do you think we need to tackle this big issue?
Man, I wonder if I could answer this in 60 seconds.
Try your best.
Okay. First, it starts with, when there's a problem, the first step towards fixing the problem is to identify that the problem exists. Now, the problem is still being debated. It's like, it's debated that it exists. Many people still don't believe. And then also many people just simply don't care. It's like, if it's not your part of your story, and if it's not an experience that you're going through, you can easily just walk through life without necessarily paying attention to that. So that's a good start. Accepting that the problem exists, understanding that the problem exists. Looking at, for example, it's not just in mental health, it's throughout everywhere. The statistics of, for example, pain medication being administered to Black people a whole lot less because of this supposed resilience that we have, and things like that, and which affects, which affects so many of us. I think, yeah, I would start with identifying the problem and then co-producing and co-developing a solution. Involve the people that are actually going through the problem in the solution of the problem. It's like there's, I guess the best example would be to yeah, just involve people, involve the people that are going through it, involve them in orchestrating an answer to that problem. Like, so this is, if you are not of that experience, it shouldn't be your place necessarily to find the complete solution for it, because you will always miss the point. And that's the issue. It stems from just not believing. So if you don't believe, you're not going to bring these people in. So that's where it needs to start. Believe us, and then listen to us. And then I don't know if that answers it in any way, but
no, it does brilliantly. No, Yannick, thank you so much for summing up such a big question in so succinctly as well. And what's excellent about what you pinpointed there is that this work that we are launching today is trying to do that, is trying to be something that is very much collaborative, looking at the issues faced by different minorities in this very difficult time. And for the first time in this wider sector of student mental health, bringing these experiences to the centre and really pumping some support that is really needed too. So it's great to have you all here, and thank you so much to all our panelists for this fantastic panel. And I'd like to invite Rosie back on to join me for wrapping up this event. So thank you so much.
Thank you very much, everyone. It was a real privilege to hear those experiences, and I think you're absolutely right, Aniska. That's, I hope, given everybody that's attended today, whether you're here live with us or you're listening to the recording, I think it's given us a lot to work on together. We are really going to invite as well. We know that people have been asking questions. We're trying to respond to as many as we can, as quickly as we can. But any we don't get to today, we will respond to outside of this as well. Do feel free to send further questions over to studentspace@studentminds.org.uk if there's something you want to follow up on us with here. I think we've got a slide as well, just to reiterate for you what these services are. So we'll just pop that up. So you've got that full suite of new services in addition to the existing text, phone, web chat and email support that students can access. So please do help us in spreading the word. And I believe we're going to have a comms toolkit going out shortly, Aniska.
Yes, we are. So now you know all about the support on offer. It's time to spread the word. In our follow-up email to you all, we'll share a comms toolkit that contains key messages, sample social media posts, graphics, template emails, and lots more. We encourage you to share the message far and wide to help reach all the students in need. I would like to take a moment to thank all the panelists for speaking and the audience for joining the session today as well. This recording will be shared in the event follow-up email, so please do share it widely, and have a good week, and thank you so much for being part of today's launch event.
Thank you. Take care, everyone. See you again.